providing resources and comfort to caregivers. This is Caregiver Crossing.
Good morning.
Good morning. Good afternoon.
Good day.
Good day.
Good day. Hi. Welcome to Caregiver Crossing. We are glad that you're here. Caregiver Crossing, for those of you who might have just, turned the dial and landed here. We are a show brought to you.
Don't go anywhere. Hold on. Give it a chance.
Oh, give your friends a chance here. We are, Caregiver Crossing is a show brought to you by Joy's House, presented in partnership with Cardon and Associates. And we are here every week to talk about all things caregiving.
And more.
I'm Tina McIntosh.
Terry Stacy is my name.
Hi.
And I'm Noah Taylor.
Noah's producer Noah is here doing a great job.
Producer Noah.
Yeah, he's producer Noah.
That sounds very official.
Yeah.
Hey, have you all seen the most recent cover of the AARP magazine?
I'm seeing it in your hands. And who's on the cover?
Hottie Boombalati, John Bon Jovi.
Hottie Boombalati for sure.
So funny enough, I had
good.
this sitting in my office, and our coworker Maggie, out of the corner of her eye, said, John Bon Jovi on the cover of GQ. And I said, that's actually AARP. And she goes, what? And I was like, that's the AARP magazine. She goes, he should not be on the cover of AARP, right? I'm like, he should absolutely be on the cover. But she meant like, we're all getting older. How is this happening?
Yeah. Well, I tell you, every time it comes out monthly, I think is when I get it, every month. And there's always somebody on there. You're like, wait a minute. Are you an ARP? Are you an ARP person? Have you really gotten that old?
ARP person.
Me too. But when you see some of the stars that you grew up, well, maybe even that were a little older than you, or maybe a little younger than you, you loved them. Like John Bon Jovi. And then you see him on what has been always perceived as like
he's
the
62,
old guy.
Terry.
He's my age.
I just read it in here. He's 62.
He's 62. And we never dated.
Are you sure?
Which is unfortunate. Every time they came to town, there I was in my short denim skirt and my white high-heeled pumps thinking, he'll see me. Well, so was everybody else.
You guys, Terry Stacy in her short denim skirt is the cutest visual I've ever seen.
Oh, but you know what? It never went well.
And
nobody ever looked at me. We all looked exactly the same. We all had giant hair and short skirts on.
Okay, let's talk about this for a second. Y'all, so I'm 10 years behind, right? I'm 52.
Yeah.
But every time somebody posts like an 80s picture, like a yearbook page of women with 80s, I swear I know them. I'm like, that's Teresa. Well, that's Jackie.
We all looked alike. We really did.
There was no differentiation between us. Unless it was the color of our skin. That was it. The hair.
Yeah. We all wanted to look that way. We all had giant hair. And
giant hair.
And you know what? And in my instance, bell-bottom jeans. And so anyway, we all looked alike. There was no way to look different.
Listen, enough about us. Let's go back to John Bon Jovi.
Oh, that's right. That's why we started this conversation on the cover of ARP.
There are some other great things in this publication. I love the AARP magazine. I say it all the time. But it's like, hey, boss, I can explain that. When menopause affects your work, or how reading your hands can tell you like secrets in your nails and knuckles and what it can tell you about your health. Anyway, I'm throwing it over here. Here it goes.
Oh, okay, good.
But I sure love that magazine.
I do too.
All right, what else? It is officially
talking to your boss about menopause. That's where we are in this world. That would have never been in like something I could go into the boss and say,
can you imagine?
You know what? I'm sorry, I flew off the handle, but I've got the menopause. You know, you just didn't do that. But here it is. It's on the cover of a magazine now, and we're talking more about it. Not only that, but how many more commercials do we need about how we smell?
Terry.
Honestly.
And I don't want to know about the parts and pieces of you that smell. And I don't want to see you putting something on it in a commercial.
I don't either.
Do we sound like old ladies?
No, not yet.
Noah's young,
Man.
so you got to check us.
No, I don't like
constant.
the commercials either. I don't want to see them. I don't want to hear it.
Well, and I don't want to talk about your erectile dysfunction in front of my kids. I just don't want to explain what ED is, but it's on, or HIMS.
Oh my gosh. I mean, it is every commercial.
None of them are going to sponsor this show now.
Well, I mean, here's what it is. I mean, even if you were feeling a little romantic and then that commercial comes on and you're like, ooh, Really?
He
He smells everywhere like that.
Right?
It just ruins a mood.
Well, let's focus on that, Terry. Let's talk about you being in the mood when the commercials
It's been a
come
long
on.
time. But I always say, you know what? If that commercial wasn't on,
Noah's like, now you sound like old ladies. It just happened.
It just happened. Just crossed the line.
Noah, it's a special
Okay.
month.
It is a special month.
What's the month?
It is Alzheimer's and Brain Awareness Month.
it is, isn't it? June.
Yeah. Worldwide, more than 55 people are living with Alzheimer's or another dementia. Join the Alzheimer's Association in going purple this month and raising awareness for June. The more people that know about Alzheimer's, the more action we inspire.
Yeah, it's true. And you can get involved. I mean, share information, change your Facebook, cover photo or put it out, share on social media. You can participate in events. The chapter of the Indiana Alzheimer's Association does all kinds of support groups and educational classes and fundraisers. And so you can find more about them if you go to alz.org, alz.org. And, we really, because we're Caregiver Crossing, we want you to be there for a caregiver. Or if you're that caregiver, take a moment. Take a moment for you. And so,
What do you think about all of the stuff? I'm such a reader. And when research is out and when, here's a new study, and I know you have to be careful and always know where these studies come from and the actual number of those that were studied and the whole bit. But now I'm reading and hearing more about olive oil and extra virgin olive oil in particular, a couple of shots a day or a couple tablespoons a day, and how it can remove plaque from your brain. And so those, these things come out and we're all on social media and bombarded with lots of stuff. And a lot of this stuff comes my way. New study, what do you think about those new studies?
All right, I'm going to take this because I know we're going to have to take a break here in a second. And I want to make sure that we say, don't go downing your olive oil. Talk with your medical team. That's what I want to say. And the other thing, Terry, and we've talked about this for years on the show, you do not need to have a doctorate. I'm not talking about you, whoever you is listening. You don't have to have a doctorate in everything. You don't have to stay up on all those studies. Just know enough to get yourself through. And if there's a study that you want to know about, olive oil, or right now I'm on castor oil,
a lot of oils.
That's supposed to be good for your hair.
Girl, another conversation, another time. But
are you drinking it?
I mean, how do I look?
What's it doing to you? I
can't talk about it right now.
But because I have been reading a lot about castor oil. See, you go down those too.
But I do, and I believe in all that kind of stuff. But here's what I want to say is every person's makeup is different. You got to talk with your medical professionals. And sometimes you do have to be bold enough to be the one to take the information to that medical professional, right? Here's a study that I recently saw. What do you know or think about this? Would this be good for me? Because I'll tell you, as somebody who's had a lot of healthcare issues, there's a lot of stuff that everybody says, this is great for everybody. And then I go to take it and my oncologist or my neurologist or somebody says, not for you.
Yeah.
So we're going to take a break. We're going to come back. We have a great guest for you, Dr. Nugent. You do not want to miss this, but we'll be back in a moment.
You betcha. You're listening to Caregiver Crossing. It is a show that is designed for family caregivers and the people who love them. Caregiver Crossing, it's brought to you as a service of Joyce House in partnership with Cardon and Associates with locations in Broad Ripple and near the University of Indianapolis campus. Joyce House provides exceptional day service for individuals living with a life-altering diagnosis and compassionate support for family caregivers throughout the community. At Joyce House, they believe that everyone deserves to live their very best life, regardless of their abilities. You can learn more about our adult day and caregiver support services simply by calling us at 317-254-0828. I promise someone will answer. Or you can visit joycehouse.org. Do that today. That web address again is joycehouse.org. And again, that number where Tina will personally answer that phone.
This is a lie.
Is 317-254-0828. Stick around. We'll be right back with more Caregiver Crossing.
Looking for ways to save on your energy bills? AES Indiana has you covered. From smart thermostats to home energy assessments, we offer simple solutions to keep your home comfortable and your costs down. AES can help you save money and energy with kits, tips, rebates, and more. Visit aesindiana.com/ways to save to learn more about how we can help you save money. AES Indiana, helping you discover real ways to save.
Did you know that parents rank financial literacy as the #1 most difficult life skill to teach? Meet Greenlight, the debit card and money app for families. With Greenlight, you can send money to kids quickly, set up chores, automate allowance, and keep an eye on your kids' spending with real-time notifications. Kids learn to earn, save, and spend wisely, and parents can rest easy knowing their kids are learning about money with guardrails in place. Try Greenlight risk-free today at greenlight.com/Wondery.
Welcome back to Caregiver Crossing. We're your hosts. That's Tina McIntosh over there. I'm Terry Stacy. Joining us today is a practicing hospitalist in Boston. She's the author of the book Prescription for Admission, and she's also an advocate in making healthcare equitable. And we say hello and welcome to Dr. Monique Nugent. Hello, Dr. Nugent.
Hi, thank you so much for having me.
We're glad you're here. Thank you very much for joining us. Tina, you get the first question.
Yeah, I just, so you are in the Boston area, is that correct?
Yeah, I'm a little bit south of Boston.
And when you tell people what it is that you do as a practicing hospitalist and a physician leader in a large independent health system, what does that mean to people?
Yeah, that's a great question, because when I tell people I'm a hospitalist, half of them like nod their head like they know what that is and they don't want to ask the question. And the other half say a hospice, and I say, no, I'm not a hospice. I'm a hospitalist. A hospitalist is an internist. I'm a board certified internist, but I only practice in the hospital. I only see patients acutely hospitalized. So you cannot call an office to make an appointment with me. And so what I do and people in my specialty do is we care for people in this acute illness setting. And it's really a unique time in somebody's life when they're either experiencing a brand new illness, we don't have a clear diagnosis, or a flare of a chronic illness, or as a disease that is progressive, changes over time, or an injury that they're not expecting, right? So this acute change is really kind of a real special way of practicing medicine, because it takes a lot of resources on how we can help someone quickly, but also how we can help somebody plan for the next steps, because after the hospital is when things continue to change for people.
Yeah, that's for sure. We've seen it. We know it ourselves. And Dr. Monique Nugent is with us. Health equity. Monique, I'm sorry. Health equity. Explain why it is a critical issue in healthcare today, and explain what it is.
Yeah. So equality is giving everybody the same thing, right? Equity is giving everybody the thing that they need. So let's take, for example, if we say that like dying from skin cancer is bad, right? We should be diagnosing skin cancers. And so we say, well, everybody gets a tube of sunblock. That's equality. Everyone now has a tube of sunblock. Mm-hmm. But does that mean that everybody is protected in the same way? So we know people who have transplants or are on immunosuppressive drugs are more prone to skin cancer. So maybe they need 2 tubes of sunblock instead of 1, right? That's equity, saying like, what do you need to prevent or to make the outcome that we're looking for, to help you in the way that you need so that this bad thing is avoided. And naturally, we're having a whole conversation around healthcare equity because the outcomes for people in healthcare are so different depending on who you are. We have different healthcare outcomes for minority patients. We have different healthcare outcomes for women. We'll have different healthcare outcomes for people who speak English as a second language. And that really shouldn't be, in healthcare, we should be striving to give everybody the best, the same best outcome possible. And so this conversation around what do you need for this outcome to be good? How can we address this issue in this community that's having this outcome because of things that we know can be affected or are affecting them in a negative way? That's really what the conversation around healthcare equity is.
I'm going to tell you, your explanation about the sunblock
It's perfect.
is perfect.
It was a perfect example.
Yeah, thank you. For those of us who, the systems are so big and the way the procedures are so big and we don't understand things, I really, really appreciated that. And, it is fair to say...
I want her to be my doctor.
Right? Well, you have to go to the hospital in Boston.
I know.
You gotta come to the hospital.
Are you taking new patients? Okay.
She takes new patients every single day.
Every day.
So here is, here's the really big question is how do you identify and address these disparities? Because we're not just talking color of your skin or your religion. We're talking your diagnoses. We're talking your genetic makeup. We're talking your
age.
Your age, the choices you make every day. So, Dr. Nugent, we have you on the show because we understand you have the solutions to all of the problems. And we have,
Yay!
You got like 2 minutes. Go ahead. Tell us what to do.
Yeah.
But truly, how do you identify those, from your experience, and how do you address those disparities?
Yeah. So identifying those, I think really we have to understand that there are a group of people much smarter than I who have dedicated their lives to researching this problem and identifying exactly this. We have really great clinicians on the ground who will say, hey, I'm seeing something that isn't right, and they'll point things out. But the study of healthcare disparities and inequity really is a field within itself. And within those fields, you have lots of people who are specialists who do that type of research kind of specifically, like kidney disparities, heart disparities. And all of this really goes under that bigger umbrella that you started the conversation with, which is healthcare equity and disparities. So I did spend some time getting my MPH at Harvard, and they have a great center for, researching this, statisticians who do it, clinicians who do it, and a lot of the other public health schools around the nation also have devoted a lot of resources to this. The other group that really kind of recognizes where we see disparate healthcare outcomes can be insurers and payers of healthcare. So if you think about it, Medicare, Medicaid, they pay for a lot of people's healthcare, and they get to see on the end, like, wow, over here, these people are getting a lot of wound issues at this hospital, or like, oh my goodness, we're paying a lot more for premature births in this type of population. So the numbers kind of come out in a lot of different ways. And we do have a lot of different voices that are saying we need to discuss healthcare equity for tons and tons of reasons. It would be great to just say, like, ethically, we should do the right thing, right?
Well, that would be,
unfortunately,
a magic wand moment, right?
Right. And it does, yeah.
So here's something that I have experienced from many different perspectives. And I feel like you already, I don't know, just what we've learned about you in the last, 8 minutes, but also things we've read about you. If we had more physicians out there like you who just took a moment to listen, wouldn't that get us to the next step with people? I mean, I know that sounds so simplified, right? But it's a big part of it is listening to your patients.
Listening and believing. Listening and
Yes.
believing your patients is a huge part of it. Historically, medicine has not been practiced by people like myself.
Yep.
Right? I'm a woman of color. I'm a child of immigrants. And I bring a different experience and feeling to the practice of medicine. Historically, medicine was this really patriarchal type of thing, like, I know the thing that is best for you. And so in addition to listening to patients, believing patients, and you can believe patients a lot easier when you have spent some time with them, or spent some time in that community, or have spent some time understanding and seeing what the experience is on their end. And so in medical school, we do spend a lot of time teaching people how to interview patients and how to talk to patients. And then you have residency, where you should be learning a lot of those soft skills, as well as, now you should be talking about having difficult conversations and having family meetings. But it really is also it's going to come down to like the emotional space and time that providers have to do the work that they allow themselves to be in. And it's very complex to just say like, oh, be a better doctor.
Right. This is Dr. And I hate to interrupt you, and I apologize, Dr. Monique Nugent. We are up against a clock, so don't go anywhere. We've got lots more questions. You're awesome, but we need to take a break. You're listening to Caregiver Crossing. It's a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you weekly by Joyce House in partnership with Cardon and Associates. We're here every Sunday. We'll be right back with more Caregiver Crossing right after this.
Bombas makes the most comfortable socks, underwear, and T-shirts.
Warning, Bombas are so absurdly comfortable you may throw out all your other clothes.
Sorry, do we legally have to say that?
No, this is just how I talk, and I really love my Bombas.
They do feel that good. And they do good, too. One item purchased equals one item donated.
To feel good and do good, go to bombas.com/Wondery and use code Wondery for 20% off your first purchase. That's BOMBAS.com/Wondery and use code Wondery at checkout.
Your weekly dose of romance and drama has arrived. Season 29 of The Bachelor is here, and Grant Ellis, certified hottie and former day trader, is trading his day job on Wall Street for a second chance at everlasting love. New episodes drop every Monday at 8/7 Central, bringing you fresh twists in Grant's journey to find his soulmate. This self-proclaimed mama's boy is all grown up and ready to invest his heart. Will his playful charm win over the house full of hopefuls, or will the competition prove too intense? From heartfelt moments to adrenaline-pumping dates, each week brings new surprises in the mansion. Will Grant find his perfect match or end up with a broken heart? Tune in every Monday at 8/7 Central on ABC and stream on Hulu for new episodes of The Bachelor.
We are back on Caregiver Crossing. I am Tina McIntosh in studio with my co-host Terry Stacy and our producer, Noah Taylor.
Hi, Noah.
Hey, how you doing?
Good.
Okay, would love to talk to you, but more importantly right now, we want to talk with Dr. Nugent. So we are back. We had, if you were with us before the break, Dr. Monique Nugent on the phone with us. She is fantastic. She is a hospitalist in Boston. She's an author of a book that we're going to talk about here in a second. And she is really making a difference when it comes to healthcare, equitable services,
Health equity and equity,
being
right.
inclusive and all the good things. Before the break, Dr. Nugent, we were talking about, listening. And then we cut you off for the break.
Because Tina made me, and I apologize.
So
Don't go
anyway,
there.
what I do want to say to you is, one, thank you, because you mentioned you are a woman of color. You were born with parents, I believe, who are immigrants. Is that right?
Mm-hmm.
And you had a lot of barriers to get to Harvard, to do the studies, to do all the things, and then to turn around and help so many other people. So thank you for being with us today, and thank you for the work that you're doing.
Oh, well, thank you for having me. This is a really fun conversation.
Well, we want to talk about your book. You have a book out called Prescription for Admission, and it's really, if I understand this right, it's a guide designed to help simplify the complexities of acute hospitalizations and help patients and caregivers navigate the often overwhelming experience of a hospital stay. I need that book right now.
I do too. In fact, I should have had. I wish I had it before now.
Yeah. What is it that you are really hoping that readers take away from the book?
What I want people to get from the book is that you can prepare for a hospital stay. It's going to be chaotic. It doesn't matter if you have a good hospital stay or not, right? Like, it's going to be chaotic. It's going to have a lot of things happening. It's going to have a lot of things changing at the end. But you can prepare. Like, right now in this country, the only people who prepare for hospital stay are pregnant people, right? They take a tour, they pack a bag, they're excited to go. And even their hospital stays are chaotic and painful. And they come out with a different life, and they have different things they have to now follow up on. And, it's not the same as when they went in. But we don't talk about how essentially all of us are going to interface with a hospital at some point in time. And how do we prepare for that? It doesn't have to be something groundbreaking, but it's a lot of conversations, and it's also a lot of knowing yourself and your information, because information is safety.
A lot of is being blamed on shortages, right? We don't have enough nurses. And I think that only continues to worsen. I never hear from year to year, oh, we're up this, we're up nurses. And so I think that's a scary part of it too, because when you try to find out and get some help within a hospital situation, we're short nurses today. So tell us how caregivers can use this information in your book to better support their loved ones during hospitalizations.
So one of the things that I say over and over is that information equals safety. And the number one thing you want out of a hospital stay is safety. You want to be safe while you're being cared for, and you want to be safe when you are being discharged. So if you're caring for somebody, knowing their medical history and their story, and being in a place that also knows their history and their story is key. So I tell people, at minimum, I want you to know the medications that you take. And if you don't know them, know where to get that list, right? Is it the CVS on Main Street that you go to? Is it your primary care doctor who has an app that you can show in the emergency department, right? That list of medications, that's a big safety issue. If we don't know what you're taking, what you're supposed to be taking, we can have bad outcomes, right? And so getting that information, that's a key piece of information. The second thing is, I said the story, right? I talk about in the book over and over, going back to a place that has cared for you before, if possible. If you're on vacation, really far away in like Colorado or something, visiting a loved one, that's a very different story. But if you're in your community, the place that has cared for you before is building your story. They have your labs from the last admission. They may have information from your primary care doctor. They know what surgeries you've had. You're not having to build back that story over and over. Why? Because information is safety. The more information you have is the more we're able to build a safe care plan for you and create a safe discharge plan for you. And that's really the thing I want people to focus on is safety. Am I safe in this moment? What do I need to be safe in this hospital stay?
I love it. What prompted you to write this book?
I've been a hospital-based physician basically my entire career, other than the few clinics I did here and there in residency. I love it. I love hospital care. It's a fast-paced, very interesting way to practice. And I've been in essentially every type of hospital setting you can think of: VA hospitals, academic hospitals, community hospitals. I currently work in a community healthcare system. I have not worked at critical access hospitals, which is a totally kind of smaller set of hospitals. But I've worked in all these different type of hospitals, and I've seen the same problems over and over and over. The same problems that my patients had at the prison ward at county hospital with communication with their medical team and not feeling like they're being heard are the same exact problems that my patients had in an academic center in the ICU. And so really, I wanted to make a book, a resource for people so that they can start learning some of the tools that we teach providers on how to communicate. They can learn these tools on how to communicate. They can get some information as to what's going on and why we do things so that they can be the driver of their care and they can hopefully improve their experience and their safety in a hospital stay.
This is Dr. Monique Nugent, and she is the author of the book Prescription for Admission. And if anybody would like to get a hold of this book, Doctor, before we let you go, how do they do it?
Anywhere that you buy books, you can buy this book, barnesandnobles.com, amazon.com. You can buy this book anywhere that you buy books. You should also check out my website, which is drmoniquenugent.com. I've got some free downloads that I remember I said skills that I teach doc providers and residents. I've got downloads on how to communicate in a family meeting and some downloads to practice writing out your medication list, as well as my blog. That I'm starting to put a few more regular posts, so you can keep an eye out for that really good information.
That's fantastic. It's fantastic. We've got just about 15, 20 seconds. Anything else you want our listeners to know before we say goodbye?
The number one thing I want people to focus on is their safety. And if you feel like you're unsafe in the moment, stop and try and gather resources and people to help you figure out why. You should always be safe in a hospital. And that's the thing I want you to get from this conversation.
Everybody should have this one. Prescription for Admission is the name of the book. It's by our guest, Dr. Monique Nugent. Thank you a million times. I hope you'll come back for a visit.
Anytime.
We're listening to Caregiver Crossing, a show designed for family caregivers and the people who love them. Caregiver Crossing is brought to you as a service of Joyce House in partnership with Cardon and Associates. With locations in Broad Ripple and near the University of Indianapolis campus, Joyce House provides exceptional day services for individuals living with a life-altering diagnosis and compassionate support for family caregivers throughout the community. At Joyce House, we believe that everyone deserves to live their best life, regardless of their abilities. Learn more about our adult day and caregiver support services by calling us at 317-254-0828 or by visiting joycehouse.org today. That web address again is joycehouse.org. Stick around, we'll be right back with more Caregiver Crossing right after this.
As you write your life story, you're far from finished. Are you looking to close the book on your job? Maybe turn a page in your career? Be continued at the Georgetown University School of Continuing Studies. Our professional master's degrees and certificates are designed to meet you where you are and take you where you want to go. At Georgetown SCS, the learning never stops, and neither do you. Write your next chapter. Be continued at scs.georgetown.edu/podcast.
Hello, everybody. Welcome back to Caregiver Crossing. I'm Terry Stacy, along with Tina Bina McIntosh. We want to talk about superfoods, but we don't want to do this just yet, do we?
All right, let's do it.
You want to do it?
All right, superfoods. Blah, blah.
Did you start to say super boob?
No, now I did. I didn't. Superfoods.
Look at producer Noah. He's starting to sweat.
Oh, man. Superfoods to eat after 50. This has been reviewed by nationally recognized dietitian Vandana Chef?
Vandana?
That's a cool name.
Vandana?
Kind of. So she's saying these are good for digestive issues and age-related muscle mass.
Oh, okay. All right.
You ready? These
I'm
are all
ready.
the things I actually love. Dark leafy greens.
Like your spinach, your...
Arugula, maybe not my favorite, but kale, spinach, yes, we've heard that, right? Those are rich in magnesium, potassium, vitamin K.
Good to be
Eat those.
reminded.
But I will tell you, just because you can eat them and ingest them doesn't mean your body always absorbs them. So make sure you're going to your medical professional, you're getting your levels drawn at least once a year, if not, twice. So there's that.
Okay.
Berries. What kind of berries do you think?
Oh, I bet it's all your blueberries, your raspberries, your boysenberries, your
what about that sour one? The really sour one.
What a cranberry?
Yeah, that's a rough one, but they are antioxidant-rich foods. Cranberries. I accidentally recently got a straight 100% cranberry juice instead of like one that has other things in
I
it.
did the same
Man.
exact thing. It's
That'll make
so
you pucker.
tart. I can't even drink it.
I tried to take a shot of it. I thought I was going to die. Like
actual pain.
I still feel it. It was weeks
So
ago.
good for you, though. Just hold your nose.
Salmon and other fish, delicious, high in omega-3 fatty acids.
Yeah.
They help decrease the risk for heart disease. And then, Terry, your favorite, often made into a salad.
It's really not.
It's
I can't
beautiful.
stand them. I take a supplement instead. Beets.
Oh, she does not
Your
like the beets.
scary beets.
Okay,
I don't care for them.
You don't have to.
I know. I just don't.
But you take a supplement.
I take the beet supplement. That's it because, and I think it's good for you.
Beetroot juice can help to lower your blood pressure.
Oh, really?
Yeah, go to a farmer's market, people. Go get all these things,
Some
right?
fresh beets.
Get yourself a basket.
Oh, now
and
you
go
guys
at it.
know you don't like the beets.
I do like the beets, and I actually like to boil them, and then they peel very easily.
Ugh.
I can talk about beets.
In the
Okay.
old days, I think that's how Cleopatra gave herself rouge.
I think also some lip glosses historically have been made from the beets. Mm-hmm. Yeah, you said rouge. Did you think of that word as you were sitting on your Davenport? Holding your pocketbook?
Stop it!
Hey, we do have an announcement.
my
A couple
pocketbook.
things Here at Joy's House One, we are hiring in guest relations. These are direct care staff positions. We also have a couple of other positions open. I think we're going to, you'll see a posting.
What are you doing? You firing everybody? What's happening?
Terry, we need to talk. It's been lovely working with you. Terry's like, I work for free. But afternoon receptionist. And then also we are looking for a finance manager. And so if you have any of those skills and you love what we do here at Joy's House, reach out to us. I'm at tina@joyshouse.org. And then our big open house is coming. Woo! Noah, tell us about the open house.
I'm so excited for the open house. It's going to be on Wednesday, June 12th, starting at 5:30 to 7:30.
Is there ice cream?
Oh, there's going to be ice cream. There's going to be ice cream.
Ice cream from Bricks.
Yes.
Not any ice cream.
Man, for
Bricks
real?
ice
I just
cream.
threw it out there. I didn't know if there really was going to be ice cream. You always have ice cream at your events, and I love it.
Well, and Chick-fil-A.
And Chick-fil-A, too?
Chick-fil-A and ice cream.
For free?
For free.
And what's some of the entersment?
Oh, we have so much fun entertainment.
Is it tap dancing?
Better. I mean, tap dancers are great.
Yes. We're gonna have some therapy dogs, and there's gonna be some miniature horses. The therapy dogs are gonna be from Pause and Think.
Oh, I love them.
Miniature horses with Agape therapeutic riding.
They come in a station wagon.
Oh my gosh, I've never seen them before.
It is pretty
I'm
great.
very excited.
Yeah. Well, and this is a big one too. We have a mini concert from the Indianapolis Symphony Orchestra members.
Oh, that's beautiful.
And there'll be
How
activities.
did you get them?
Well, magic.
That's just a busy time.
So you need to come see us on Wednesday, June 12th, 5:30 to 7:30. All of the things and people and foods and wonderful Joy's House stuff. And, you know, if you've ever wondered, like, what do they do at Joy's House? What are they like? Come see us. That's us. I mean, these are people.
They're fantastic.
It's like having family. We have old families, not old like, oh, I'm aged, but like old families, people that used to use services come back because this is like a family reunion for us.
A part of it is just a small part of it, but I still love this part of it is this is an old farmhouse.
Yes. Yes.
And it just feels like you're in a home, you know, that you've come to someone's home. Joy. You came to Joy's home.
You did.
For a visit.
So come visit.
Come and see what it really is like. It's not like anything else.
And I have a thing I can only tell you a little bit, but at 5:45, so this starts at 5:30. At 5:45, we have a huge announcement we're going to make. And it has to do with Caregiver Way, our online platform. Visit caregiverway.com. So that is one of our caregiver services. You can learn more by coming to see us on June 12th from 5:30 to 7:30. But at 5:45, and I really am not trying to make light of this, a huge announcement about Caregiver Way and how we're going to be able to help thousands and thousands of you across the state. If you want to learn more about Caregiver Way, go to visitcaregiverway.com or just go to the Joy's House website and you'll find it there. But it is an online community for family caregivers it's kind of like TikTok and Masterclass had a baby, and we give you a community and really, I don't want to say everything you need to know as a caregiver, but we're doing our best with it.
It's going to be a lot.
It's pretty awesome.
It's fantastic. Hey, would it be okay? Can they get a care kit? Maybe
Yeah.
while they're here?
Yes, you
it's
can.
a good chance to pick up a care kit while you're here, which is so incredibly important.
Care kits are binders filled with template information. It's kind of like a Caregiver 101 class, and it helps you keep everything together. I've used it for more people than I care to admit. But the other thing is, if you become a member, $10 a month on visitcaregiverway.com, all of the care kit pages are in there, and you can, it's
you can
fillable
just do it
PDF,
online.
and you can download it.
Which is the future, really, Tina. The internet, I don't think it's going to go away.
I believe the children are our future. We've been singing the song all day. But I do want to tell you, if any of this has confused you or overwhelmed you, welcome to our brains. You can email me at tina@joyshouse.org. Again, Tina, Tina, @joyshouse.org. I can connect you to all the people and places. But in the meantime, no, we've got somebody we want to thank.
Caregiver Crossing is supported by Cardon and Associates, with 20 communities owned, operated, or managed in the Midwest and more than 40 years of senior living experience. Cardon and Associates provides residents with the best senior living options and personalized service. Until next time, take good care of each other.